Okay, so before we start doing our stretches, I wanted to talk about some of the movements that have to do with joint range of motion. Okay, so we're talking about joint movement. So if I were to bend my elbows, what's a word for that besides bend?
Flexion.
Okay, flexion, right? Flexion is decreasing the angle at a joint. Okay, so that happens at your joints. You say, I'm sure you've all used the term or heard the term flex your muscles. Well, you don't really flex your muscles, you flex your joints. Okay, so elbow flexion, what other joints can perform flexion? Your knee, right? Knee flexion is bending at the knee, okay? Okay, ankle, and in ankle you have two types of flexion, right? You have dorsiflexion and plantar flexion, okay? Good. Shoulders, flexion in the shoulders is a little bit different. When you're talking about flexion, all movement, by the way, starts from anatomical position, which is erect alignment. So shoulder flexion is a little bit different. Shoulder flexion, this is forward flexion, and this is horizontal shoulder flexion. But yeah, shoulder flexion. Okay, what about your hip? Okay, hip flexion. Okay, so your joints pretty much all flex, and then extension is anatomical position. Hyperextension is going beyond anatomical position. So if I locked my knees out, I would hyperextend my knee joint. If I did a back bend, I'd be hyperextending my spine. All right, so hyperextension is going beyond anatomical position. So right now, I'm at extension at my shoulders. If I go backward, I'm actually hyperextending. If I bring my leg back, I'm hyperextending my hip joint. Okay, so anatomical position is full extension. Going beyond anatomical position is hyperextension, and making the joint smaller from anatomical position is flexion. Okay, so flexion and extension. All right, what other things can we do from the joint? How about rotation? Okay, rotation, your shoulders rotate. Remember, your shoulders and your hips are ball and socket joints, so they move pretty freely. The only thing that inhibits their movement is the structures around them. The muscles and tendons and ligaments can restrict movement. So you don't want your joints really loose, because otherwise they won't be able to do their job, but you want them stretched so that you can go through your full range of motion. So shoulder rotation. Okay, hip rotation, it rotates in, it rotates out. Trunk rotation. All right, so your knee doesn't really rotate except when it's at 90 degrees. You have a very limited amount of rotation at your knee, but for purposes of your test, it just does flexion extension. Okay, what about when I move my arms away from my midline? What would you call that?
Lateral flexion.
No, but it's a good guess. It's not lateral flexion, but that's a good guess.
Oh, abduction.
Okay, it's abduction, right? If I said to you, somebody got abducted, they would have been taken away, okay? So when your limbs move away from your midline, if you had a line going down the middle of your body, movement away from the midline is abduction. Movement of the scapula so that they're coming out that's scapular abduction. This is scapular adduction. Adduction, think of adding to, coming in, moving toward the midline is adduction, adduction. Okay, so flexion, extension, rotation, abduction, adduction. Okay, this is actually called circumduction. And your hips do it too, circumduction. That I don't believe is in your course material, so you won't really be responsible to know circumduction, but that's what it's called. Good. Okay, what about my wrists? What's that called? Pronation and supination. If you had a bowl of soup, your wrist would be supinated. Okay? If you drop the soup, they'd be pronated. Okay, so supination, pronation. In anatomical position, they're actually supinated. Okay, also at your wrist, you have flexion Extension is at anatomical position, hyperextension beyond anatomical position, and then you have lateral flexion also at your wrist. Okay? All right, any questions about that? All right, so you want to learn to think in terms of those types of movements when you're thinking about programming your clients and putting your information together.